Welcome to the dental implant aseptic setup technique. Let's begin by putting on sterile gloves. Raise a patient's chair to your waist level and then incline. Place the aseptic kit on the patient's chair and open it up. In the kit, notice there are two separate packs. The smaller pack contains 2 surgical gowns, one for the dentist and one for the assistant. It also contains 2 hand towels. Place a small pack on the counter next to the implant motor and open it. Next, turn your attention to the larger pack. It contains all that you will need to set up your operatory room. Unfold the pack with the bottom side down to create a safe and sterile landing zone for all the surgical items to follow. Although you are wearing gloves, they are non-sterile. Therefore, it is crucial to not come into contact with any of the surgical items. Begin with the irrigation tube. Peel back the wrapping. Allow the irrigation tube to fall from the packaging into the sterile zone. Then drop the packaging onto the floor. Repeat the procedure with the anesthetic syringe. Strategically place the stainless steel prep cup to catch the following items: a number 15 blade and a number 12 blade. Add the sutures to the pile, following the same procedure. Next, add the handpiece, saline bag, and the BioHorizon surgical drill kit. Add the implant surgical instrument cassette, 4x4 gauze, and irrigation syringe. Remove non-sterile gloves and drop them on the floor and put on sterile gloves. From this point forward, everything must be sterile. Begin by taking the utility drape. Open it with the adhesive facing up. Remove the adhesive backing as shown and stick the adhesive side of the utility drape on the counter, making sure to cover the largest area possible. Open the implant surgical instrument cassette and lay the instruments on the utility drape. Put aside the instrument cassette. Next, place the 4x4 gauze, 2x2 gauze, and sutures. Place the irrigation syringe and anesthetic syringe on the utility drape. Next, take the patient's sterile bib, unfold it, and cover the surgical instruments.
So you're following that part over there.
Take the second utility drape, unfold it, remove the adhesive backing, and stick it onto the side unit as shown. Place the BioHorizon surgical drill kit on top of that. In the pack, there are 4 light handle and chair button covers. Place covers on the light handles and chair buttons as shown. In the pack, there are 4 Sani sleeve hose covers. 3 will be used for the suction hoses, and 1 will be used for the implant motor cable. Follow the installation as shown. Take the saline, irrigation tube, Sani sleeve, handpiece, and motor cable from the sterile zone and place them onto the utility drape next to the implant motor. Pierce the saline bag with the spike of the irrigation tube, making sure the drip gauge is on the off position. Assemble the handpiece to the motor cable and place a Sani sleeve as shown. Assemble the irrigation tube through the irrigation reel of the implant motor. Now that the setup is complete, dispose of your sterile gloves and the discarded wrappings.
This is for a training thing. Oh, how's it going for you?